Hi, my name is Gallagher. I'm a plastic and reconstructive surgeon with a special interest in gender affirmation surgeries. In this video, I'm going to talk about zero depth vaginoplasty, also known as minimal depth or dimple vaginoplasty, or some folks will just refer to it as labiaplasty or vulvoplasty. So first of all, what is this procedure? So this just basically means we're doing feminizing bottom surgery, usually for our male to female patients, but not creating a vaginal canal, so that everything really looks the same on the outside as it would with a vaginoplasty. We're creating the clitoris, removing the penile tissue, creating the labia, but skipping the creation of the new vaginal canal. So this means, of course, when there is no new vagina there, that a patient doesn't have to undergo dilation. So what patients go for this procedure? So we know from a big study of over 400 patients that was done in Oregon on the West Coast that about 10% of patients coming for feminizing bottom surgery will choose this option. And when they looked at why this was, about 63% of patients chose this option because they still had full vaginoplasty available to them. They were well enough to have it and didn't have any what we call contraindications to having vaginoplasty medically, but they chose to skip the creation of a vagina. So I'm going to talk a little bit in my practice about why patients choose to do so. So I think the most important factor for my patients is it's something they've really well thought out, usually with the help of their therapist and their partner, and they're really just not interested in having or using a vagina for sexual purposes. So that would be the most common reason. Other things to take into consideration are patients who don't want to do dilation, don't want to do douching, and who don't want to take the increased risks of having a vagina created. So when we talk about risks, we know that probably the trickiest thing about male to female bottom surgery is the creation of the new vagina. And the reason this is we're creating a passage so below the bladder and the prostate and above the rectum. And it is possible, we think, in about 1 in 100 cases that we could injure another structure around there. Most concerningly, most surgeons would agree that would be the rectum, and we can create a difficult problem to fix, which I've talked about in other videos, known as a rectoneovaginal fistula. So really, by having a zero-depth procedure, patients are removing what is probably the most morbid part of the procedure. Now, personally, I feel that the risks of vaginoplasty are pretty low. So this probably shouldn't be the main reason to have this, because a patient really needs to think this out well, because it can be very difficult to create and line a new vagina if a patient were to later change her mind. Now, again, we know from that study in Oregon that this is highly unlikely, and 93% of those patients were very satisfied with their choice. So again, it's not something to undertake lightly. A patient needs to know that this is the right surgery for her, but if she chooses to do so, the recovery is of course a little bit easier, because you don't have to learn how to take care of the new vagina and all that goes along with that, including the pretty intensive dilation schedule patients have to do, and therefore patients will go back to work sooner, and usually I have found patients will leave the hospital a little bit earlier. So I hope this answers the question about zero depth. Like I said, it can be very confusing. Lots of different names for it. We see it called just labiaplasty. I've seen it called, I think, cosmetic vaginoplasty, minimal depth vaginoplasty, zero depth, dimple, lots of different names for it, but it basically means doing all of bottom surgery on the outside except skipping the formation of a vaginal canal.